What if I told you that right now, your body might be sending you a warning signal about a stroke that could happen weeks from today? Every year, nearly 800,000 Americans suffer a stroke. That's one every 40 seconds. But here's what most people don't know. Your body often tries to warn you up to 30 days before it happens. The tragic part? These warnings are so subtle that many people completely dismiss them as stress or aging. Today, I'm going to show you the specific early signs like unexplained fatigue and how recognizing them could save your life. The first warning might be hiding in numbers you check every day. Blood pressure spikes that doctors fear most. Your blood pressure readings might reveal patterns that emergency doctors consider more dangerous than any single high number. Most people think a consistent reading of 140/90 signals trouble, but recent research from the American Heart Association shows that wild swings in your blood pressure actually double your stroke risk compared to steady high numbers. When your readings jump from 120/80 in the morning to 160/95 by afternoon, then drop back down by evening, your arteries endure repetitive stress that steady high pressure never creates. The most dangerous pattern doctors now watch for is called morning surge hypertension. This happens when your blood pressure spikes dramatically within the first hour of waking up. We're talking about increases of 30 to 40 points in your systolic pressure that occur almost every morning. Your body naturally raises blood pressure when you wake to get your circulation moving, but when this surge exceeds 140/90 consistently, it creates microscopic tears in your artery walls. These tears become collection points for cholesterol and blood clots, setting the stage for a stroke weeks later. What makes these fluctuations so deadly is how they fool both patients and doctors. A person might have a normal reading of 125/80 at their doctor's appointment, but their home monitor shows spikes to 175/105 during stressful moments or physical activity. These sudden spikes create what researchers call pressure storms inside your arteries. Each storm weakens the blood vessel walls a little more, like repeatedly inflating and deflating a balloon until it finally bursts. Your damaged arteries actually send out distress signals through these blood pressure changes, but most people write them off as stress or caffeine effects. When your arteries start to harden and narrow, they can't expand and contract normally to accommodate blood flow changes. This creates erratic pressure readings that seem to come from nowhere. The pressure spikes aren't random, though. They follow specific patterns that predict stroke risk with frightening accuracy. Emergency doctors focus on identifying dangerous blood pressure variability when someone comes in with stroke concerns. Large swings in your readings harm arteries through repetitive stress that damages vessel walls over time. This variability creates more arterial damage than steady high pressure because your blood vessels never get a chance to adapt or heal between pressure surges. Home blood pressure monitoring has become essential because these dangerous patterns only show up when you take multiple readings throughout the day. The new guidelines recommend checking your pressure at 4 specific times: immediately upon waking, mid-morning, late afternoon, and before bed. You need to take these readings for at least 2 weeks to identify the patterns that predict stroke risk. Single readings at the doctor's office miss the fluctuations that matter most. The physical symptoms that accompany these dangerous blood pressure patterns are unmistakable once you know what to look for. Pulsing headaches that match your heartbeat indicate that your brain arteries are struggling with pressure changes. These aren't typical tension headaches. They throb with each pulse and often get worse when you bend over or strain. Chest tightness that comes and goes throughout the day signals that your heart is working overtime to pump blood through narrowed arteries. Vision flickering, where your sight briefly dims or you see spots, happens when pressure surges temporarily reduce blood flow to your optic nerves. When your blood pressure readings enter the danger zone, meaning morning surges above 140/90 or wild swings throughout the day, you need immediate action. First, sit down and take 3 deep breaths. waiting 2 minutes between each reading to confirm the numbers. If the high reading persists, avoid caffeine, reduce sodium intake for the rest of the day, and engage in light physical activity like walking. However, if you're experiencing chest pain, severe headache, or vision changes along with high readings, you need emergency care immediately. The breakthrough in stroke prevention comes from new, rapid-acting medications that can reduce stroke risk within hours of dangerous blood pressure spikes. These medications work differently from traditional blood pressure drugs because they target the specific mechanisms that cause pressure storms. ACE inhibitors combined with calcium channel blockers can stabilize blood pressure fluctuations within 24 hours, giving your arteries time to heal from the damage caused by repeated pressure spikes. What's particularly concerning is how quickly these blood pressure patterns can cause permanent arterial damage. When your arteries experience repeated pressure storms over just 2 to 3 weeks, the damage becomes irreversible. The artery walls develop scar tissue that makes them permanently stiff and narrow. This creates a vicious cycle where even normal blood pressure becomes dangerous because the damaged arteries can't handle any pressure changes. The most dangerous misconception people have is thinking that blood pressure medication alone will protect them from stroke. While medication helps control the numbers, it doesn't repair the arterial damage that irregular pressure patterns create. You need to address the underlying causes of pressure fluctuations, which often include sleep apnea, chronic stress, dehydration, and medication interactions. Many people take multiple medications that unknowingly create blood pressure swings throughout the day. Sleep patterns play a crucial role in these dangerous blood pressure fluctuations. When you don't get deep sleep, your body produces more stress hormones that cause morning blood pressure surges. People who sleep less than 6 hours per night or who have interrupted sleep show the most dangerous pressure patterns. The connection between poor sleep and stroke risk is so strong that doctors now consider sleep quality as important as blood pressure numbers when assessing stroke risk. Understanding these blood pressure patterns could save your life because they give you weeks of warning before a stroke occurs. The key is recognizing that steady numbers aren't enough. You need to watch for the fluctuations and patterns that reveal arterial damage. But blood pressure changes aren't the only warning your body sends. Sometimes the most important signal comes disguised as something completely different. A type of exhaustion that no amount of rest seems to fix. The exhaustion that signals brain trouble. This bone-deep exhaustion that no amount of rest can cure represents one of the most overlooked warning signs of an impending stroke. You can sleep for 12 hours straight, drink multiple cups of coffee, and still feel like someone drained all the energy from your body. This isn't the tired feeling you get after a long day at work or staying up too late. This is persistent, unexplained fatigue that settles into your core and refuses to leave no matter what you do to fight it. Recent neurological research has uncovered why this happens and why it's such a critical warning sign. When blood flow to your brain becomes restricted weeks before a stroke, your brain tissue doesn't get the oxygen and nutrients it needs to function properly. Think of your brain like a high-performance engine that suddenly isn't getting enough fuel. It can still run, but it has to work much harder to accomplish the same tasks, leaving you feeling completely drained even from simple mental activities like reading or having a conversation. This type of exhaustion combines overwhelming mental and physical fatigue that creates a perfect storm of feeling awful. Thinking feels like you're walking through thick mud, where every thought requires tremendous effort and concentration becomes nearly impossible. Physical weakness affects your muscles and coordination, making you feel unsteady and clumsy even during routine activities. When these symptoms hit you simultaneously, the exhaustion becomes overwhelming and unmistakable. You might find yourself sitting down frequently during activities that never tired you before, like folding laundry or preparing meals. Simple conversations become exhausting because your brain struggles to follow the thread of discussion and formulate responses. You feel like you need to concentrate intensely just to understand what people are saying to you. And by the end of the conversation, you're mentally drained. Mini strokes, which doctors call transient ischemic attacks, or TIAs, often announce themselves through episodes of unexplained exhaustion that come and go over several weeks. During a TIA, blood flow to part of your brain gets temporarily blocked, usually for just a few minutes. While the blockage resolves quickly, it leaves your brain cells damaged and struggling to recover. This creates waves of exhaustion that seem to appear randomly, but actually follow the pattern of these mini strokes occurring in your brain. The timing of this TI-related exhaustion provides crucial clues about what's happening. You might feel completely normal when you wake up, then suddenly feel overwhelmed with fatigue around. Mid-morning, the exhaustion might last for several hours, then gradually improve by evening, only to return again a few days later. This pattern of exhaustion that comes in waves over weeks indicates that your brain is experiencing repeated episodes of reduced blood flow. When fatigue becomes a stroke warning sign, it specifically affects the brain regions that control alertness and energy regulation. The reticular activating system, located in your brainstem, normally keeps you awake and alert throughout the day. When blood flow to this area becomes restricted, maintaining normal alertness requires enormous effort. The thalamus, which acts like a relay station for sensory information, also struggles when blood flow decreases, making you feel disconnected from your surroundings and mentally foggy. What makes this stroke-related exhaustion particularly dangerous is how it resists all the usual remedies for tiredness. You can drink coffee until your hands shake, but the mental fog persists. You can take naps throughout the day, but you wake up feeling just as drained as before. You can go to bed early and sleep deeply, but morning brings the same overwhelming fatigue. This resistance to improvement is your brain's way of telling you that the problem isn't lack of sleep or too much caffeine. It's lack of adequate blood flow. The exhaustion comes with other symptoms that make the overall picture particularly concerning. Difficulty concentrating becomes so severe that you can't follow the plot of a television show or remember what you read in a paragraph. Memory lapses start affecting your daily routine. You forget appointments, lose track of conversations mid-sentence, or can't remember why you walked into a room. Coordination issues make you bump into door frames, drop things more frequently, or feel unsteady when walking, especially when you're tired. Doctors have developed specific questions to differentiate stroke-related fatigue from other causes of exhaustion. They ask about the pattern of fatigue. Does it come in waves or remain constant throughout the day? They inquire about cognitive symptoms. Are you having trouble finding words or following conversations? They explore physical coordination. Are you dropping things or feeling unsteady more often than usual? They investigate the timeline. Has this type of exhaustion been building over weeks rather than days? The medical evaluation also focuses on what doesn't improve the fatigue. If rest, sleep, reduced stress, and caffeine avoidance don't help, doctors become much more concerned about brain-related causes. They also ask about morning symptoms specifically, since stroke-related fatigue often feels worst when you first wake up, before your brain has had time to compensate for reduced blood flow overnight. New diagnostic tools can detect the brain blood flow issues that cause this type of exhaustion before permanent damage occurs. Advanced MRI techniques can measure blood flow velocity in specific brain arteries, identifying areas where circulation has become sluggish weeks before a stroke. Transcranial Doppler ultrasound can detect narrowed arteries that aren't supplying adequate blood to brain regions controlling energy and alertness. Blood tests can also reveal markers of brain stress that accompany this type of exhaustion. Elevated levels of certain proteins indicate that brain cells are struggling with inadequate oxygen supply. Inflammation markers show whether the blood vessels supplying your brain are under attack from immune system activation. These blood markers can confirm that exhaustion is related to brain blood flow rather than other medical conditions. Recognizing this exhaustion pattern can prevent permanent brain damage because it provides weeks of warning before a major stroke occurs. The brain tissue affected during this early warning period can often recover completely if blood flow gets restored quickly. However, if the warning signs get ignored and blood flow continues to decline, the same brain regions that initially caused exhaustion will suffer permanent damage during a stroke. Regular monitoring and immediate doctor follow-up when this type of persistent fatigue appears can make the difference between recovery and permanent disability. But exhaustion isn't the only way your body warns you about stroke risk. Sometimes the most telling signs appear in places you check every day without realizing what you're seeing. Vision changes your eyes can't hide. Your eyes reveal warning signs that most people mistake for minor annoyances or aging. While you're blaming those strange vision changes on computer screen time or needing new glasses, your eyes might actually be sending urgent warnings about a stroke that could happen within the next month. Most people dismiss fleeting vision problems as normal signs of aging or eye strain, but these seemingly minor changes often represent the first visible evidence that your brain's blood supply is in serious trouble. Recent ophthalmological research has revolutionized how doctors understand the connection between vision changes and stroke risk. Scientists have identified specific vision patterns that can predict a stroke within 30 days with remarkable accuracy. These patterns aren't random vision problems. They follow predictable sequences that reveal exactly what's happening inside your brain's blood vessels weeks before a major stroke occurs. The breakthrough came when researchers realized that the eyes act as windows into brain circulation, showing problems that brain scans might miss. The vision changes that signal blocked arteries are subtle but distinct once you know what to look for. Fleeting blind spots appear as dark patches in your vision that last anywhere from a few seconds to several minutes, then disappear completely. These aren't the typical floaters that drift across your field of vision. They're fixed spots that block your sight in specific areas. Brief double vision episodes make you see two images of the same object, usually lasting less than an hour before your vision returns to normal. Temporary visual distortions cause straight lines to appear wavy or bent, text to look blurry despite clear glasses, or colors to seem washed out or overly bright. These vision changes happen because your optic nerve is incredibly sensitive to blood flow disruptions. When arteries supplying oxygen to your eyes or brain become narrowed or blocked, even temporarily, your optic nerve responds immediately by creating visual symptoms. The optic nerve requires a constant supply of oxygen-rich blood to function properly, more so than almost any other nerve in your body. When blood flow drops even slightly, the nerve cells start malfunctioning, creating the warning signs that appear weeks before a stroke. Your optic nerve connects directly to multiple areas of your brain, which means vision problems often indicate that brain blood flow is compromised in several locations simultaneously. When you experience vision changes, it suggests that the same arterial problems affecting your eyes are also affecting brain regions responsible for movement, speech, and thinking. This connection explains why vision changes are such powerful predictors of stroke risk. They reveal widespread circulation problems that haven't yet caused obvious brain symptoms. Emergency physicians have learned to identify specific visual symptoms as critical red flags that require immediate intervention. Sudden peripheral vision loss, where you lose sight in the outer edges of your visual field, indicates that blood flow to specific brain regions has been severely compromised. Visual field cuts, where you lose vision in distinct patterns like the left half of your visual field or the upper quadrants, suggest that particular brain arteries are becoming blocked or have already experienced mini-strokes. These emergency vision symptoms differ from gradual vision changes because they appear suddenly and affect specific patterns rather than general blurriness. A visual field cut might make you unable to see anything to your left side, even though your central vision remains crystal clear. Peripheral vision loss might leave you with tunnel vision, where you can see straight ahead but lose awareness of objects or people approaching from the sides. These patterns tell emergency doctors exactly which brain arteries are in trouble. The timing and triggers of vision changes provide crucial diagnostic clues that help doctors identify stroke risk. Many people notice these vision problems during specific activities like reading, watching television, or using computers, activities that require sustained visual focus and can stress already compromised blood vessels. Others experience vision changes at particular times of day, often in the morning when blood pressure naturally surges, or in the evening when circulation slows down. Physical position changes can also trigger vision symptoms when blood flow is already compromised. Standing up quickly, bending over, or turning your head rapidly might cause brief vision loss or distortion. These position-related vision changes indicate that your brain's blood supply is so marginal that even minor circulation changes cause symptoms. The pattern of when and how vision changes occur helps doctors determine how urgently intervention is needed. New eye imaging technology can detect stroke risk by examining the tiny blood vessels in your retina. These retinal blood vessels are the only blood vessels in your body that doctors can see directly without surgery. Advanced retinal photography can reveal narrowed arteries, small hemorrhages, or areas where blood flow has been disrupted. This technology can identify people at high stroke risk even when they haven't noticed any vision changes yet. When you experience any vision changes that could indicate stroke risk, the time frame for seeking medical attention depends on the severity and duration of symptoms. If vision loss is severe, affects large areas of your visual field, or comes with other symptoms like weakness or speech problems, you need emergency care immediately. For less severe but recurring vision changes, you should see a doctor within 24 to 48 hours to assess stroke risk and begin preventive treatment. Different types of vision problems predict different types of strokes, giving doctors valuable information for treatment planning. Double vision and coordination problems often indicate strokes affecting the brainstem or cerebellum. Visual field cuts typically predict strokes in specific brain regions that control vision processing. Temporary blindness or severe vision loss suggests problems with the arteries supplying the visual cortex or optic nerves. Ignoring vision warnings creates a dangerous cascade that can lead to permanent sight loss and brain damage within weeks. When your optic nerve isn't receiving adequate blood flow, it indicates that other brain regions are also struggling with reduced circulation. The same arterial problems causing vision changes are simultaneously damaging brain tissue responsible for movement, speech, and thinking. But vision changes aren't the only warning signal your brain sends when blood vessels are in crisis. Sometimes the most urgent alarm comes in the form of pain, so severe it feels like your skull might split open. Headaches that scream emergency. These headaches represent your brain's most urgent alarm system, delivering pain so intense it feels like lightning striking inside your skull. This isn't the dull ache you get from stress or the throbbing pain that builds gradually throughout the day. This is a headache that reaches maximum intensity within seconds and refuses to respond to any pain medication you throw at it.